Fighting diabetes, the disease remains a major threat to public health. But as the world marks World Diabetes Day, what's been done to combat it? And what's behind the rapid rise of diabetes around the globe? This is Inside Story. Hello and welcome to the programme. I'm Sahil Rahman. Now, one person dies from diabetes every 6 seconds. That's how long I've been on your screen so far. And by the end of this programme, 250 people will have died from the disease. What's worse, the World Health Organization says diabetes is becoming even more common around the world. And that's why prevention is the focus of this year's World Diabetes Day. Researchers say half of all adults with diabetes don't know they have it, and late diagnosis can lead to serious complications, including blindness and kidney failure. This year's awareness campaign encourages people to get tested as soon as possible and tells them how to recognise early signs of diabetes. But is early diagnosis enough? What about preventing the disease entirely? Well, we'll talk to our guests in just a moment, but first let's just take a look at the numbers globally. The World Health Organization says 1 in 11 adults has diabetes. That's 415 million people. In the next 2 decades, that number's expected to rise to 642 million people. It's mainly poor countries that are affected. 3 out of 4 diabetics live in so-called low and middle income countries. Last year, 5 million people died from the disease, and the highest prevalence is in the Middle East, where 1 in 7 people are diabetic. Now, there are 2 types of diabetes, both having to do with insulin. It's a hormone that regulates blood sugar in the body. People with type 1 diabetes are not able to produce enough insulin on their own, and they need to take the hormone through shots of insulin pumps every day to keep their blood sugar in check. And the cause of type 1 diabetes is really still unknown. Type 2 diabetes, on the other hand, is a result of misusing the insulin that the body produces. Now, this is more common, a version of the disease, and it's normally a byproduct of obesity and a lack of exercise. And the symptoms are less obvious, which make it difficult to diagnose. Well, let's get the thoughts of our guests. Joining me here in Doha is Dr. Abdullah Al-Hamak. He's the Executive Director of the Qatar Diabetes Association. And in Geneva, we have Dr. Jojka Rotlic, Technical Director and Officer at the Diabetes Unit at the World Health Organization. Good to have both of you here on the programme. Dr. Rotlic, can I just bring you in first, just to give us a global idea about the gravity of the issue so far, and how high up on the medical agenda, or not, is diabetes when state governments have to deal with a whole range of problems, HIV, cancer, Alzheimer's?
It is, in fact, very high on the agenda of all governments. The governments have made a commitment 5 years ago at a high-level political meeting to reduce the mortality attributable to 4 major non-communicable diseases that are the major killers that lead to premature mortality. And those are cardiovascular disease, cancer, diabetes, and chronic respiratory disease. So governments do recognize that diabetes is a problem, and there are now numbers that really substantiate this and provide a basis for this decision and this commitment to reduce mortality and reduce the burden of diabetes itself.
We will go into further detail about the specific countries and regions of the world where there is the issue of diabetes, obviously, and some countries deal with it better than others. But on the whole, over the last 20 to 30 years, how has the global population, global governments, how have they managed to deal with diabetes? Have they been successful in tackling the problem?
Well, so far, there is no success story, unfortunately. No country has documented reduction in the prevalence of diabetes, or not even a no increase in the prevalence of diabetes. That is because the risk factors are increasing. However, some success stories have been documented in improved treatment and improved survival, and we can go later into some detail about that.
Okay, Dr. Hammock, let me bring you in here because you're an expert certainly with the Qatar Diabetic Association, qualified doctor of diabetes sufferer yourself. You know the region very well.
Yes.
Just as a broad opinion,
Yeah.
how does the Middle East factor into this very complicated global equation? How severe is the problem of diabetes within the population here, in the Gulf states, for example?
Yeah, I think we call it this a tsunami in the world. Actually, the diabetes, especially 5 of the Gulf states, is still in with the top 10 list of the Diabetes Federation, so the International Diabetes Federation. So I think also we are in the Gulf, we are suffering a lot of this one, and not only in the prevalence rate, but even it's a costly disease. We spend a lot of money treating this disease in our country.
In terms of the symptoms here
Yes.
in the Gulf states,
Yes.
what seems to be the general cause of why the rates are rising here? And the rates vary, don't they, from country to country?
Yes. But I think we are in the same. I mean, I'm talking about the GCC countries, because in the 4 decades, our grandfathers, they are more active. They also when they eat, they eat a very, you can say, a healthy food. But after we discover the oil, now we go to the sedentary life. So we don't move, so inactive, and also our food now is unhealthy food. It's much of carbohydrates and food.
So you're saying that sort of a Western style or
Exactly.
a different non-Arabic style of diet has contributed to this?
Yes, exactly. So the lifestyle changes in our area. That's one of the causes of the diabetes, of the rise of diabetes in our area.
Dr. Roglic, do we stand a chance of actually combating the way we deal with our food intake? If we just deal with food to start with, because the statistics are very clear, really, aren't they, that it's part of the problem for diabetes is the food intake, and the type of food that one consumes can be a factor in whether you develop diabetes or not.
Yes, the type of food certainly has an impact. Moreover, it is the caloric intake which leads to overweight and obesity that increase the risk of type 2 diabetes considerably, and which is compounded with, as the colleague from Qatar mentioned, the lack of physical activity in countries, which is brought on by industrialization, urbanization, globalization, the globalization of the food market, and fewer people work hard physically. Food has become cheaper. The calorie-dense food has become cheap. Healthy food is more expensive. So all these are challenges to beating this epidemic.
And in the WHO statistics, initially you also said that global countries or global national governments are trying their best, but the forecast is quite worrying because in 1980 we had 108 million globally people affected with diabetes, and it was projected that 422 million by 2014. One wonders what has happened for this figure not to reduce, and how large that figure could become in the next 10 years.
Well, the figure has risen because of the rise in the pervasiveness of the risk factors. So a poor diet, increase in the number of people who are overweight and obese, also increase in children of overweight and obesity, and young people, which has pushed the age of onset of type 2 diabetes lower, about 10, 15 years lower than it was before. So these last 30 years are the result of all these risk factors accumulating and affecting metabolism.
Well, let's just give our viewers a little bit more background to this for a moment, because obesity and diabetes often go hand in hand, as we've just mentioned. And in Mexico City, it's the young who are particularly vulnerable. The country has one of the highest rates of child obesity in the world, as John Holman reports.
Lunchtime for many in Mexico means this and this. Mexicans drink more fizzy beverages than almost anywhere else in the world. The country's also #1 in child obesity. All of that has led to rocketing diabetes in the nation's young, many of them in working class families like the Atriscos, who struggle to afford the healthy food and medical kit to control the illness. It took an urgent operation on 15-year-old Ricardo's pancreas to make him and his family realise he had to give up street food and eat healthier.
I cried a lot, and even now it's really difficult. It breaks my heart all the things he's gone through because of diabetes.
Diabetes figures in Mexico are rising, even as efforts are being made to tell people of the dangers. The situation's urgent. The disease is one of the top 2 killers in Mexico, and that's why the government and civil organisations have organised a fair for World Diabetes Day, complete with Mexican wrestlers to try and spread the message and publicise a bit more the impact of this illness. But educating the public hasn't been enough, so in 2013 authorities went further, levelling a 10% tax on fizzy drinks. Studies showed it reducing sales, but when Senator Rios Peter recently proposed doubling it, Congress refused to back him.
We're heading for a structural healthcare crisis for our population. So if this measure doesn't pass, the lawmakers that aren't supporting it should have to explain why.
In many marginalised communities, Coca-Cola is easier to get hold of than drinking water, and just as cheap. The government says it's installing more free water fountains in poor communities and trying to provide healthier school lunches. But for now, the onus is still on individual families to choose fruit and veg over tacos and quesadillas. And that's a hard sell here. John Holman, Al Jazeera, Mexico City.
Dr. Hammock, the position of the young is something that concerns lots of governments, including those here in the Middle East region. WHO figures say that in 1980, over 18s, there were 4.7% of the population globally was suffering from diabetes. In 2014, that rose to 8.5%. How concerned are governments in the region and North Africa about the way the young people are eating and the health problems that they're facing?
Yeah, I think I remember when we have a meeting with the International Diabetes Federation that they are focusing on the prevention program. So they encourage all the government in this area, in the MENA region, that they should have what we call it the national diabetes program. So nowadays the government, even in the Gulf area now, they have started to have that program. And in Qatar now, we just start with our national strategy for the prevention of diabetes here in Qatar. So I think, that will give us, how important, to fight diabetes. I think regarding the obesity, I think this is the same, even in our country now. I think 4 years back, we did a survey through the family council. We in our schooling setting, they get about 40% of our children, they get obesity, and I think Dr. George said that this is as a very important risk factor to have obesity, diabetes. Is
the message getting across, though, from the money that, for example, the Qatari government, the statistics from the WHO suggest that Qatar, for example, spends more money per capita on trying to get the message across, yet has the second least prevalence of diabetes compared to maybe countries like Saudi Arabia, Bahrain, Kuwait and the UAE. So certainly Qatar has a commitment, just as all the other Middle East countries do have, but the populations obviously are much larger in places like Saudi Arabia. But is the message getting through? And if it's not getting through, why?
Yeah, but I think, if we are comparing our statistics, I mean, we improve in our messaging actually. So let me give you some examples. In 2008, we did the survey, national survey for diabetes. It's come to 16.8. So the Minister of Public Health did a survey, what you call through the validated by WHO, what they call stepwise survey. We get 16.7, the same result that they get in 2008. So what did that mean? That means our program, even with the Minister of Public Health, we achieved something. People now, they know about diabetes, how to prevent diabetes. But I think always when we talk about diabetes, when we educate our population, the problem with diabetes, it's linked with the behavior changes. You know, it's very, very difficult. I mean, to convince people.
There are cultural differences, aren't there? You're talking to a European audience who are quite open, perhaps, about discussing medical ailments to an Arab community.
Yeah.
Arabs are quite private and quite sensitive about such information and, dare I say it, criticism, and therefore much more guarded about how they deal with that research and also how they deal with the message. It's very difficult to get perhaps through those barriers, those cultural barriers.
Yes, I agree with that, because still it's a stigma. Regarding some people, they hide that they were diabetic, but when you educated, no, I am a diabetic. I mean, I don't feel shy when I say I'm diabetic. I mean, but before, even in a woman's side, sometimes because if she's a diabetic, maybe do not get married. So still there's some stigma in our society, not in Qatar, but in the Gulf. As a whole.
Dr. Rolich, you heard that. Cultural sensitivities are very important, you know, to not have the perfect body, to not have the perfect image, or healthcare can be to the detriment of the individual depending on which society you're living in. It could actually be a matter of either life or death, or marriage, no marriage, a future job or not. And those barriers have to be broken. That's a difficult one, not just for the WHO, but perhaps for you in Geneva to work with those national governments to try and make them understand that obviously it's very important to get the message across and to break those barriers within society.
Yes, it is unfortunately indeed very challenging. The cultural norms, the perceptions of beauty and health are often linked with overweight rather than normal body weight. And it's not, unfortunately, only a question of getting the message across. It is the environment that has to be conducive, that has to incentivize healthier behavior, a healthier diet, and healthier and physical activity. So the possibilities have to be there, and it is very much outside the hands of the health sector itself. They can spread the message about good physical activity, but if it is unsafe or culturally unacceptable, or if a healthy diet, which is typically the case, is more expensive than an unhealthy one, it is very difficult to translate the knowledge, the health knowledge, into healthier behavior. So that is a very big challenge for the government. So that is one of the interventions of the Mexican government and some other countries has been to introduce the tax on sugar, to introduce the tax on sugar sweetened drinks. And they have documented reduction in the sales. They have yet to document what the effect actually is on the population. And of course, research has to come in here and to see whether people have really changed behavior or they have replaced sugary drinks with something else that is also unhealthy. So there is a lot of research to be done in the area still. On a
broad sort of spectrum, can you just give us a global perspective now? We said we'd come back to this question on which areas of the world are doing well or which countries are not doing so well or have difficulty, because it's not just about having a stable nation. Many countries are having to deal with civil strife as well, aren't they, or economic downturns, and therefore budgets and money availability to deal with diabetes are a real problem.
Yes, and the interventions that so far have given hope of being effective, that there is some evidence, are all interventions that interfere in the economy, in interests of many people and interests of a powerful industry. So they're not very easy to politically introduce. But some countries have introduced a ban on advertising unhealthy food to children. Children are a very susceptible audience, so that is an intervention that will probably decrease and hopefully decrease obesity in children. The sugar tax, let's see what happens with that. And of course, challenging in times of strife, it probably has more effect on the care that people with diabetes are given rather than on the prevention.
Dr. Hamek, let me just bring you in here. You're hosting a huge event here in Doha at the end of the week to discuss how to move forward. Yeah. What do you hope the aims will be of that conference, briefly?
Well, I think our conference actually we were focusing on the problem that is facing the diabetes preventions in the area, in the Gulf area. I think we will sharing some experience with other countries in this regard, and also to leverage our knowledge of our GPs, because now we have instead of just to focus on the secondary prevention, we have also to the primary healthcare. It's very important to educate our GPs about diabetes, about how to to deal with it with the patient, because this is the first access for them, So that's what we are hoping to.
Ms. Rolich, let me just bring you in here. We're coming very close to the end of our programme. In terms of the message that the WHO would like to get out to our international audience watching this programme, those with children, those that are carers looking after their loved ones with diabetes, or even government officials watching thinking, how do we move forward with diabetes? It's a problem in our area. What's the message the WHO would like to get out?
Well, the message, several messages would be that it takes a multi-sectoral approach to prevention of diabetes. The health sector alone cannot do it. So it takes the commitment of all the ministries, including transport, education, agriculture, trade, everything. Another message is that the most costly diabetes is the one with complications, which means that people with diabetes should be diagnosed early, and not only that, but also treated well. And treatment of diabetes is abysmal in many, many countries. And even in high-income countries, some people with diabetes develop complications because they haven't been treated well. A big problem is access to affordable treatment. So that is another problem to overcome. And there are many complicated and complex reasons behind that in poor countries, many people still lack access to life-saving medicines such as insulin, which have been around for almost 100 years. And that is morally unacceptable.
Well, on that note, we will have to leave it there, but it's been a fascinating conversation. Thanks to my guests, Dr. Abdullah Al-Hamak and Dr. Gojka Rohlich there in Geneva. And thank you to you for watching. You can see the programme again anytime by visiting our website at aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter, and our handle there is @AJ Inside Story. From me, Sahil Rahman, and the whole team, thanks very much for your time and your company.